So welcome to the Enhancing Clinical Practice and Outcomes stream at the SNOMED CT Expo 2023. And for those of you online, good morning from Atlanta. So my name's Ian Green. I'm the Customer Relations Lead for Europe and also the Global Clinical Engagement Lead for SNOMED International, and I'll be moderating today's session. So all questions will be answered at the conclusion of the presentation. For those online, please can use the Q&A button to type in your questions to the presenter, and I'll make sure we ask them. For on-site attendees, we'll have a roving mic so you can ask your questions in person. So without further ado, I'm now pleased to introduce Marte, who's from the Directorate of eHealth in Norway. And she's going to be presenting on standardized care plans in nursing and a focus on implementation. So Marte, over to you.
Thank you, Ian. It sounds like you can hear me now. Yes. Hello and welcome. Thank you for coming to this presentation. My name is Marte. I am a registered nurse. I'm also an unregistered nerd. And with me today, I have Beate. We have cooperated on the presentation. She's also from the Norwegian Directorate of eHealth and the Norwegian NRC. So we work with the standardized care plans in nursing and implementation of these on a national level. If you become inspired by this presentation today, you can watch my presentation from last year in Lisbon. I think it's still available. But I'm still going to refresh your memories by a quick summary of the standardized care plans in Norway and how we have worked with that. And then I will move forward to talk about how we have been working with the nurses in the implementation process, also how we've been working with the vendors in the implementation process. We have extrapolated some success factors for the implementation in Norway. We have met difficulties. And also I will wrap up with some feedback from patients and their families now that these plans are available through the Norwegian eHealth portal. So this will be my presentation today. Beate and I will take questions at the end, like Ian said. I have to be decisive with this. So there is a national collaboration between the 4 health regions in Norway, also with the Norwegian Nurses Association and the Norwegian ICNP Center in making the standardized care plans for nursing. So we have 34 national care plans for nursing, and they stem from the Norwegian Patient Safety Program. There's also a lot of regional and local plans that are being reviewed for national status. The plans are used mostly in specialist care, but also some in primary care, and that is an area that we're working with going forward. We're also going to start working with plans with mental health and substance use problems. So that is sort of for the future. I can talk about that in Korea, probably. So you don't get rid of me this fast. All of the plans are built on ICNP and SNOMED CT with a bit of modifications, but I'm going to talk about that as well. Oh, goodness. The presentation is gone.
There you go. Keep going.
Yeah, thank you. It's good to get some help from the audience. So it's Ian's fault, or is it Terrence's fault? No. The nursing process is a modified scientific method. It is evidence-based, and the nursing process have been used both in developing the standardized care plans and also in implementing the care plans. This process is used by nurses in other aspects as well, and it helps them to find and choose the relevant diagnosis, outcomes, and interventions for their patients. So this model is used by the nurses working in the standardized care plans and implementation in the EHRs and in other systems. So the experiences we have working with the nurses, is that on project level, using the SNOMED City browser has worked quite well. These nurses are now experienced in using SNOMED, using the browser, limiting their searches, seeing like parents and children, and finding the relevant concepts that they need. But on site in clinical practice, it has been difficult for the nurses to search in like all of SNOMED CT because it's quite big now. So we have developed an easy search engine that runs only on the ICMP and SNOMED CT reference sets. And I will actually show you how this works a little bit later. So another experience is that in ICMP, there's a lot of combination concepts. SNOMED CT are not that keen on those. So for instance, assisting with personal hygiene and dressing have become two concepts in the plans, one for assisting with personal hygiene, one for assisting with dressing. And this has happened on a lot of different places. So in the beginning, there has also been some discussions about what should be the preferred terms, because doctors have a different need, for instance, for what should be the preferred term than the nurses have. For instance, pruritus might be a bit foreign for a lot of people when itching of skin does the job very well. But we considered in the beginning to make a nursing language reference set, but that sounded like a lot of work. So we have instead worked with the nurses and getting them on board with the new way of using terms, getting used to the new terms, and also seeing the benefits of using the same terms all over the healthcare. We have also found that the international ICMP reference set was missing a lot of the concepts the nurses needed. So we have kind of our own ICMP reference sets in Norway that we have filled up with more SNOMED CT concepts based on the clinician's needs. So these we have just added to the reference sets, translating them into Norwegian, and we have also made some new concepts for the Norwegian extension of SNOMED CT. I think we have now like 400 and something more concepts in our reference sets than in the international reference sets. So we have donated some of our new concepts to SNOMED International. We have tried donating some of these concepts to ICNP International. We haven't had much luck there yet, but the concepts are available in SNOMED for the ones that want to use them. And we have been working very close with the nurses in the implementation process. So there have been very close distance, very short distance from what they find that they need for their plans, what they need in the clinics, and until they can get them from us. That has been a process that like takes days. And we find that this is a very important success factor as well, that they know that they can tell us what they need and then they can get it back and start using it. So that's been very positive. Well, I'm only pressing once, I swear. We also have experience working with vendors, because when you're starting to implement stuff, you need somewhere for it to be. So the vendors needed a sort of an additional information model to ease the implementation in the EHR. I talked a bit about the implementation model last year, but like the standardized care plan is a package, you know, with evidence-based content. If you have a patient that is has a risk of falling, you get like risk of falling with the nursing diagnosis that's common for that patient, the outcome that we want to work towards, and the interventions we need to get there. So some of the EHRs have connected the interventions to the goals, and some of them have connected the interventions to the diagnosis. That doesn't really make a big difference in practice because it's still a package that belongs together. But then you have a patient that's prone to falling, maybe they fall, and then they're in pain, and you need some goals and problems connected to pain as well, without maybe implementing the whole pain plan as well. So they needed a way to search and choose individual goals and problems and interventions. And to make this easier, we made 3 different reference sets for the content of the ICMP reference set in Norway. One of them for the diagnosis, one of them for outcomes, and one of them for interventions. And this goes hand in hand with the simple search that I told you about easier, and I'm going to show you like how this works together. This way of dividing the information up makes it easier for nurses in the EHR who wants to like find a relevant diagnosis to only get hits on diagnosis when they search, and so on. We also have a tool that's not in EHR that is an independent vendor. They're called VAR Healthcare. They have implemented SNOMED CT as a reference terminology in their system. And this is a tool for evidence-based healthcare procedures. It is implemented in the EHRs, and it has now been nationally procured in Norway by the Norwegian Directorate of Health, making it available to all nurses. Earlier, it was like up to the different, not regions, but like further down the different counties, whether or not they wanted to buy this tool and give it to the nurses. Now it's available for everyone. And it's also used in the education of nurses in Norway. So this means that the nursing students are now being introduced to SNOMED CT concepts. They are learning to do the procedures the same way as they should do in clinical practice. When they start working, they will recognize SNOMED CT that they're going to use in the plans and in the documentation. So this is really cool because we can get it into like all the stages that the nurses work in. So this is also available in the EHR, whether you use the care plan module or not. So it's really cool that they have put SNOMED into their system. We have helped them with that though. So okay, this is a different this is different what I have in my my notes, but that's okay. I will do it my way. So as I mentioned earlier, we developed an easy search engine that is that's running on Snowstorm, where the search is based on the 3 different ICMP reference sets. So you can see here diagnosis, outcome, and interventions all have their different search fields. So that means that if I, for instance, search or write in fall, you will get a different result from each search field. I know you're probably highly intelligent, everyone, and this might be dumbing it down, but I'm just going to show you how it works. So you see there that you get like in the diagnosis, you get all the problems. In the outcomes, you get the sort of the goals, the outcomes you want to achieve for the patients. And intervention, you only get the interventions needed that has fall in it. So this is separated from the information model I talked about in the standardized plans. This is independent from the package. Here you can only search on words and get what you need. It's a very good tool when you're building the plans, that these are separated from the template of the standardized care plans. And now I will talk about success factors. So the 3 reference sets have been really good for both the nurses and the vendors implementing the standardized care plans and ICMP in SNOMED CD as a sort of reference for all of the documentation. The simplified search is very popular among our nurses. Does that mean that my time is up? No. We see it as a success factor now that we didn't make an additional language reference set, because that would just mean a lot more maintenance. So that work with the maturity on the languages, we can see that as a success factor as well. The very close collaboration that I talked about has been a success factor, because we have been in a very intense period where a lot of stuff has been made, and they have been working very hard and very fast. And if then they had to wait ages to get the information available, that would probably stunt the whole process. So unless you've already figured it out, I'm going to tell you something that will make SNOMED International recoil in their seats. Maybe I should cover his ears. But these ref sets, these ref sets have been running on the daily build, has been, and that way they have been available the day after we've made them. But I'm going to calm everybody down with saying that we're now working with frequent releases in Norway, and that we will move the search engine and the reference sets to the released content. So it's been as a tool for getting it done. We know it's not optimal to do that like permanently. Oh. We also have some difficulties. We met some difficulties. Who doesn't? It's more fun to talk about everything that's running smoothly and has gone great, but you know, we can learn from each other's mistakes. It's difficult, but we can. So the standardized care plans, there's still some insecurities where they should live and in what format. Right now, they're available on the Norwegian ICNP website as Word documents, so that when they're reviewed, they're being put back there and you can choose to take them down and use them. So this is not optimal. We have tried and showed you last year a proof of concept on how they could live in snowstorm. And there are other possibilities to pursue. So we're not gonna drop that ball just yet. But what we have done locally, not locally, but nationally, the Norwegian NRC is now taking the ownership of the 3 reference sets, and we will update the reference sets in collaboration with the National Editorial Group. So one of the regions already have a functioning management and maintenance team locally. So they filter stuff before it comes to us and answer a lot of the clinicians' needs. And they are helping other regions in Norway to set up the same kind of system. The National Editorial Group is still responsible for the content of the standardized care plan and are updating the clinical content every 2 or 3 years. And they will continue doing this going forward. So some of the sort of administrative stuff have been fixed, and some of them are still to be announced. So we got some feedback as well. So even though, like I said, the implementation process is still going on in some health regions, other places have been using these plans for quite some time. And they are available through the National eHealth portal, where you can see like other parts of your clinical record. You can see your vaccination, you can have secure messaging with your clinician. So the patients and the patients' families can access the care plans. Feedback has been coming in from both patients and their families not to us directly, but to our regional contacts, that getting access to these plans gives security to the families, make families aware of what kind of problem areas that are in focus and what the goals are after a procedure or after an injury, and can help their family members moving on in the right direction, not using the clinical interventions as such, but sort of become aware of how to help them in the best possible way. So this is very empowering for both the patients and the families. So it is very nice to hear that they can actually participate in achieving the goals for family members after a hospital visit. So I hope you get more of that kind of feedback going along. So in conclusion, the implementation of standardized care plans in Norway are still going forward, now also in primary care, now also in new kind of fields that we haven't really touched earlier. Close collaboration with the nurses is a critical success factor, and also finding good solutions for helping vendors implement this in a way that is useful for nurses. Because if the nurses don't want to use this, they're not going to use it. So having this close collaboration is very important. So that was about it. Beate and I will take questions now, and thank you so much for listening.
So thank you, Marta. Marta, I'll now take questions. As a reminder, if you're in the room, please use a microphone. So I'll wander around with the microphone. And if you're online, please put any questions in the Q&A. So, hang on, I'll come to you. As I seamlessly slide across the room.
Hi, I'm Susan Matney, and I know ICMP and I know SNOMED, and I'm wondering if all the new content that you're working on, the other countries with ICMP that could possibly put that into SNOMED, are you working together with other countries?
We are working together with Sweden. We're also talking to Denmark, and Beate said we're also talking to Iceland a little bit, even before we met this morning. So, but yes, and we inform the Norwegian ICMP Center of everything we do. We give them all the content that we find in SNOMED and that we make ourselves, so that they can give that to ICMP International. But that process, I understand, is a bit slow these days. So we have given some of our new concepts to SNOMED International directly, because they can be used other places as well. For instance, in the social care program, I saw that Jane Miller left, but but we have been.
Don't end up in the ref set.
No, they don't end up in the international ref set, and we think that's sad, because we've been working hard with this, and we think that a lot of nurses can use this content. So if anyone can help us sort of light a fire under ICMP International's ass on this, maybe we can, get this going faster. Pardon my French.
I didn't realize you were multilingual.
I am a member of ICMP editorial board, which you're indicating slow process. Actually, whenever there is a request coming from country like Norway, we review the concept and see whether there is a semantically equivalent concept in SNOMED city, and then we incorporate them into ICMP references. So I don't know, there must be some kind of miscommunication, or we would like to take as fast as we could. I just want to make sure.
That is great. It might just be a blockage in the system between Norway and International, but I would love to talk more with ICMP International because we've made a lot of good stuff. Yeah. Thank you. And thank you for coming.
You just want me to run to the back of the room. Hang on a minute.
He needs the exercise.
Hi, I'm Shamla from India. I have a question on the how do you collect feedback from the family members once you've published the care plan?
It is the regional, the health region gets the feedback from the families, and then they deliver it to us. We don't have contact with the patients or their families directly. So that comes through the right. No, not through the system. They don't have. They can't put feedback into the system. No.
Hi, thank you for a great presentation. It was full of great ideas and going forward with action. I was wondering about these standardized care plans. If you could describe just a little bit what goes on in putting these together, the process of finalizing those care plans, what's behind them?
That is what my whole presentation from last year was on, but I can try to comprise it a bit. No, we have, like I said, an editorial group with nurses from all of the different regions, the Nurses Association and the Norwegian ICMP Center. And they've taken the patient safety program with like the most of the areas where we need to improve patient care, and they have started there. And like I used the risk of falling, risk of malnutrition, more examples, Beate. Diabetes, for instance, and then they have gone into research and finding the best practice and finding what are the most common problems with these patients, what goals should we connect to these problems, what interventions are relevant to use. So they have been making these packages, and they've been updating the content, the clinical content, every 2 to 3 years to keep them updated. And these are the 34 national plans have been made by this committee over several years. And they started working with Nick and Nanda, and then they went over to using ICNP. And when ICNP became a part of SNOMED, we have used SNOMED. So Beate and I was very lucky in that this organization already existed, and they were working with the clinical content. So we had a very good head start there nationally before we got into the picture as well.
So with that, I'm going to conclude this session. So thank you, Marte.